Hi, this is Aaron Cook coming from Physical Therapy and Balance Center in Mentor, Ohio. We're here with episode 2 today of our Help Yourself Learning series. Today we're talking about back pain. Specifically, we're talking about how to find a position of comfort for your back pain. Most Americans will experience pain in their back or sciatica or some of these other scary terms at some point in their life. As physical therapists, we're used to seeing back pain every day, and we know that the right treatment strategies early on can save somebody a lifetime of pain and suffering. So we're trying to help get the word out early on of a couple of simple things you can try to help your back. So most types of back pain have what we call a position of comfort. The key is finding what yours is and trying to spend as much time in that position as you can. For some people, that's just laying on the floor for a couple of minutes at the end of your workday. Sometimes that's all you need to calm down that back pain brought on by work or by kids or whatever you're doing in your life. So there's two general strategies that we're going to try. The first one tends to apply more to the older population, though it can apply to younger people. Particularly, I see it in pregnant women or people that have recently had kids. What this is we would call like a double knee to chest position. So what you're gonna do is you're gonna get on your back. You're gonna try and bring your knees up. You may find this position alone is enough to take some of that tension off the small of your back. But what you can do is I would start with just one leg. Try just bringing one leg up at a time into your chest. See how that feels. That generally feels pretty good for a lot of people. I would caution if you're an older adult and you've had a hip replacement in the past. This is one I would be a little cautious with. So you can do one at a time, or even better, you can try both at a time. This generally feels really, really good. It can really loosen that back up. Now, for your younger crowd, most commonly under the age of 65, most people fall into the following category of back pain, and that's generally where it's what we would call an extension bias, where being back propped up on your elbows really calms down that symptom. This would be your classic sciatica, when you have that shooting pain down the back of your leg, maybe some numbness and tingling, maybe some pins and needles. This would be a good one to try for you. What I tell people is try these when your symptoms are at their worst. You don't want to do these when your back's feeling good. You want to do these when your back is really flared up. So what you could try is you can try laying on your stomach and see if you can get into what some people will call a sphinx pose or a prone prop. I always say like you're trying to read a book, like you're trying to sit here. I would start here and see if that takes some of the tension off. You may notice if you have that sciatica down your leg, you may notice after a couple minutes here that that sciatica will actually start to come up and not bother as much of your back and down your leg. If you want to take that a step further, you can get almost down into like a push-up position, and you can try coming up, getting a good stretch. I would hold this a couple seconds at a time. You can even kind of come up and down with it a few times. Especially if you have sciatica, this would be a great exercise to try just to calm those symptoms down. I do these at the end of the day sometimes if I've been lifting my kids, if I've been really working hard after shoveling a lot of snow this week. This has been really, really beneficial for my back. All right, that is 2 simple stretches that you can try. As always, consult your doctor if you're having severe pain, but we hope that helps.